Good afternoon and welcome to SHM's Education Consult Series. Today we have Dr. Alex Chinn from the University of Tennessee, myself, Dan McFarlane from the Ohio State University, and Dr. Jennifer Readlynn of the University of Rochester. And today we're going to talk about learner evaluations. So our learning objectives today, we're going to describe some competency-based education, both in the UME and GME world. We're going to utilize best practices for filling out behaviorally anchored evaluations, and we're going to construct meaningful comments for learner development. Alex, welcome, and I heard you had a question.
Hi, Dan. Thanks for having me. Yeah, I'm very new to a teaching group, and I've started to get evaluations for my students and my residents I've worked with. And I'm feeling a little bit overwhelmed by reading through and trying to answer all the questions. I'm not entirely certain what the scales on the evaluations mean.
Yeah, that's a really common question that we get. So let's kind of walk through a little bit about why the evaluations are structured the way that they are and what those comments really mean. I think they can be really confusing. And a lot of times people fill out the evaluations sort of thinking about like this student was a bad student, this student was a average student, or this student was a good student. That's sort of where they land, and they give students that they think are good sort of all fives. But it's really not how most of the evaluations for most programs are designed. So most of the evaluations are really designed based on competency-based education models. And for medical students, they're governed by the LCME, which is the Liaison Committee for Medical Education. And for the residents, it's the ACGME. And so those are the governing bodies that really talk about what should a learner learn by the time they've completed their program. For medical students, it's in trustable professional activities, there are 13 action-based EPAs that are really focused on things that they should complete by the time they're done with medical school and as they transition into starting residency. For the residents, they have milestones, which are based on the ACGME 6 core competencies, and they are actually anchored to what they should know by the time they complete residency and are a practicing physician, so an attending level. And the interesting thing about these evaluations, or most of the evaluations that are competency-based, is really that they're behaviorally anchored. So they describe a behavior upon a continuum of novice to expert, where their anchor is that expert. So again, for the medical students, it's graduating medical school student. And for the residents, it's graduating resident. So most third years are really going to be, third-year medical students are going to be somewhere in the 2 to 4 range on a 5-point scale, whereas most of your fourth years are going to be in that 3 to 5 range on a 5-point scale. And each of those competencies is independent of the other. So they may be a 2 in one activity or one competency, and a 5 or a 4.5 in another one. They may have areas where they excel or areas where they're weaker. And then same thing with residents. Again, it's that practicing physician. And sometimes I feel a little bit silly because I feel like sometimes I don't even, as a practicing attending, meet some of those level 5 milestones all of the time. And so, but again, most interns are sort of in that 2 to 4 range, and residents are in that 3 to 5 range. And I think it's interesting because I think we feel bad if we don't give our learners, all fives, those really good learners. But really, again, if you just read sort of what the behavior that's described and sort of compare it to where your learner is, then that's going to give them the appropriate score. And then it's also going to give them availability to look at sort of what's the next behavior that's down the line, and it gives them areas where they can improve and continue upon that curriculum to expert level. I hope that was helpful. Are there any other questions that you might have, Alex?
Thanks, Dan. That really cleared things up a lot about the grading scales. At the end of every evaluation, it asks for comments. And I'm just curious what things are actually helpful to clerkship directors and to residency directors when I'm filling out comments.
You can take that one. Thanks for asking, Alex. That shows that you care about your students and what goes into their evaluations. So one of the first things I like to do when I'm meeting with a new team is find out what everyone's goals are at the beginning of the rotation, understanding that you do not need to comment on every single competency or milestone that learners might get evaluated on. But really, if you can give some good observations of behaviors for select areas that are important to you as their educator and as the learner for their own personal growth, that's probably where you're going to have the most impact. So really ask your learners at the very start, when you're setting those expectations for the rotation, what are their goals? What are they trying to work on? And how can they improve? And then hopefully throughout the rotation, they'll be getting feedback on those goals and where they're at. And those are some of the things you can comment on. So first, defining areas where they did well. There's always something our learners do well. And seeing how it compares to another learner at that level. Are they where they're expected to be? Are they maybe below where they're expected to be? And again, that could be completely different on different competencies. So maybe someone just really connects with the families that they're working with, and they're above the level of expectation for their level of training. But then they have a really hard time organizing their presentations, and they might be below the expected level. So again, it really depends on what you're focusing on when you're commenting on behaviors that you're observing for your learner. And like I mentioned before, learners should be getting feedback throughout their rotation, not just at the end. And their response to that feedback can also inform their sort of motivation, their attitude, and how well they can incorporate that feedback and develop their skills. And that's a really important piece for people to know. No one's expected to be perfect, us as attendings included. And so sort of having that skill to develop and move on to the next thing or respond to feedback is really helpful. And then again, we're all trying to work towards expertise, and defining areas for improvement with clear next steps is helpful too. So the learner, when they go to a different attending or even a different service, knows where they can continue to grow, especially with self-defined goals that they've already talked about. Hope that was helpful.
And Jen, that was so helpful. Thank you so much for your time.
Yeah, I think, Alex, I think the key thing really is just don't feel pressure to give learners high evaluations because you like them or they're great or you just think that they're good. I think the evaluations really are informative or try to be informative upon that continuum. So, when a lot of programs get, all fives down the line, that's just not really helpful for the learner or for the program. So I appreciate you really trying to be thoughtful and deliberate about filling out evaluations for your learners so that you can actually really help them. So thank you for participating, and please fill out the evaluation to help give us more information and provide better modules for you.
Thank you.